Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right 8 and the lower left 8. The lower right 8 on the panoramic view is horizontally is mesioangular impaction. It's quite deep into the ramus. We can see a radiolucency on the distal aspect of the lower right 8 as well. And we can also see that it is very closely associated with the inferior alveolar nerve canal. On the transaxial view, which is basically the proximal view, we will actually be able to show you the relationship of the wisdom tooth to the inferior alveolar nerve. So this is the wisdom tooth right here. As you can see, it's we've got a radiolucency on the buccal aspect. The wisdom tooth is lingually placed. We've got very thin lingual bone, and we've got approximately initially we've got 2 millimeters of space between the inferior alveolar nerve and the lower right wisdom tooth. We've got good space here, which can be, which does not need any guttering because there's a very big this gap between the bone and the wisdom tooth. This gap is extending all the way to the apex as well. As you are moving distally, you will be able to appreciate that even though the wisdom tooth is more lingually placed, the inferior alveolar nerve is placed buccally, but it is significantly far away, which is approximately again 2 millimeters away from the wisdom tooth on the lower right hand aspect. So, in terms of extraction, this tooth should pose no threat or problem to the inferior alveolar nerve. The lingual cortical plate is very thin and the tooth is very closely associated, so that will need to be kept in mind when extracting this tooth. So overall, the lower right wisdom tooth is significantly far away from the inferior alveolar nerve, and there is no threat of damage to the nerve as a result of extraction of this tooth. This is another axial view angle, and here also you can see that the lower right wisdom tooth, which is right here, is actually 3 millimeters away from the nerve. Now we're starting the lower left wisdom tooth. The lower left wisdom tooth again is also quite lingually placed. It has a significant distance from the inferior alveolar nerve, which is approximately 6 millimeters. Again, very thin cortical plate present in the lingual aspect, and you can see that the lower left wisdom tooth. So, as you can see here, we've got a significantly closely associated nerve, the tooth and the lingual cortical plate. The nerve is significantly far away, and hence we have a gap between the bone and the tooth on this aspect as well. As you're moving distally, you will be able to see that the nerve and the tooth remain quite afar, and there's absolutely no risk of nerve damage as a result of extraction of this tooth, although the lingual plate is very, very close and hence need to be kept in mind when extracting the lower left wisdom tooth. So if there are any further questions regarding this case, please feel free to reach to our team. We will be extremely happy to help. Thank you very much.